The Center for Working Families is a resource in the community that is multifaceted to connect people to educational resources, legal advocacy, fatherhood programs, sisterhood programs, leadership opportunity, hard skills training, and almost any area that a person will want to improve their lives.
I see the center as one of those core organizations recognizing what it takes to revitalize community, to bring people together where they are, and to empower them to change their lives, their families' lives, and their community life.
What I really liked about the Center for Working Families, not only did they come into the community and make a big difference, but they asked the residents of the community, what is it that you need? What can we do to help you move to the next level?
And so at the center, we got involved in Green and Healthy Homes, or GHHI, to bring together a bunch of strategies that we think can help make a change. One, we're interested in people, families, children, being healthier, because when they are healthy, they can go to work and they can go to school. And if those two things don't happen, it's tough for a community to be healthy. Two, we focus on putting people to work. And so getting involved in the Green and Healthy Homes initiative and having a real jobs focus, helping people from the community be able to get jobs and making the community stronger and better and fixing those homes, helps bring income into the community and helps children see their parents be involved in making a change. And then three, because of the deep partnerships we have, the fact that we can work with government, we can work with legislators, and we can work with people in the community, we can bring together this constituency in a unique way that really helps leverage those so that we can get policy change to make sure that going into the future, we can help make sure that people don't have these problems in their home.
And the center, through its work, is really at the core of that. And I think a shining example of what nonprofits can be, focused on mission, providing data-driven outcomes, and collaborative practices that really engage a total community. So I think the center is a wonderful example of what nonprofits can and should be doing.
Marrying the technical expertise of Southface with the trusted, deep relationships that the Center for Working Families has with their communities, I think is the best way to ensure success. And as a training provider, we would define success as building lasting capacity within the Center for Working Families and the residents of their communities to ensure that homes will be healthy and safe and affordable for years to come.
And our commitment here in the Department of Planning and Community Development is to provide safe and decent housing for all citizens of Atlanta. And to further that commitment, we are partnered with the Center for Working Family and furthering that commitment by providing decent housing for individuals. And not only that, but we've worked with them on other projects like the lead-based Green and Healthy Homes initiative that we've been involved with them over the past couple of years. And we hope to collaborate with them on more educational programs that help deal with the health and safety of the home. And as we can continue this collaboration, we hope that we will benefit each other and benefit the citizens of Atlanta.
When I went into a family's home, I didn't think that she would let me in, and it was like 3 generations, and also there were kids. So they were asking me, what is the education part on lead? And when I was running all these different things down to where it can cause, be connected with high blood pressure, kidney failure, those things like that. And asthma is the #1 chronic illness among, children today.
The community health workers that work with the Morehouse School of Medicine and the Center for Working Families promote the health of the individuals who are being helped by the Center for Working Families. And so it really turns out to be a great partnership, one in which we're able to help promote the health of the community served by the Center for Working Families, and the center is able to help promote the health of the individuals who come there for not only job placement, but for other services as well.
That's the beauty of the Green and Healthy Homes Initiative, is that it's a holistic approach to dealing with problems. It's not just related to repairs, but how a person lives in the house and how that home environment affects their health as well. So it's quite different from a rehab program where we just mainly focusing on the structure and not so much on the family and the family's living habits in the house.
I'm very pleased that they're going after this new program. Environmental and healthy living continues to be a challenge for the city, but at the same time, by working with the center and doing some in-house policy changes, we think that this challenge can be overcome.
The design of this program is inevitably something that we hope is going to influence policy change. If we can create a mechanism where it's a standard process for a community health center to work with an organization that builds on workforce development and capacity, to automatically connect as a vehicle of assessing the needs of a patient, then we consider that closing a significant loop or filling a significant gap.
The way that the Casey Foundation is working in Atlanta, especially in this set of neighborhoods, is that we really see ourselves as kind of the venture capitalists. We really see ourselves as being the seed investor, the first in. Because what we really are hoping to do is that we're hoping with our initial investment is to really prove that we can really produce great results for families and kids. In this case, the results have been phenomenal.
The Center for Working Families is one of those organizations out there solving problems. We need to make sure that it's a part of the safety net that nonprofits provide in our community.
We believe our commitment to the Green and Healthy Homes work will allow us to make deeper inroads in Atlanta, influencing results at the nexus of improving health outcomes for families and children, leading resident engagement through community advocacy and education, and making lasting changes through advancing policy to create needed systems change.